Endocrine emergencies, diabetes. Glucose is sugar, which is fuel for cells. Proper amounts of glucose in blood ensures proper brain and cell functioning. Changes in levels may result in altered behavior. It is also regulated by the pancreas. A rise in blood sugar stimulates secretion of insulin. Insulin release slows as blood sugar drops toward normal. Excess glucose is stored in the liver and muscles as glycogen. The pancreas releases glucagon, and glucagon stimulates the liver. The liver breaks down the glycogen into glucose. Diabetes is a condition in which insulin is non-existent, minimal, or non-functioning. Without treatment, it leads to high blood sugar. There are two types of diabetes: insulin-dependent diabetes, which is type 1, and non-insulin dependent diabetes, which is type 2. Type 1 diabetes, or insulin-dependent diabetes, is early age of onset. The pancreas also lacks of insulin production. Type 2 diabetes, which is non-insulin dependent diabetes, is later age of onset and is also associated with obesity. Some cases are resolved with weight loss, and the cells are less receptive to insulin. Medication is required to improve insulin sensitivity, and the common medications used are metformin, chloropropamide, glyburide, and some may take insulin. Hypoglycemia is rapid onset and changes in mental status. You will notice within the patient sweating, hunger, a rapid pulse, rapid and shallow respirations, seizures, which come late, and bizarre behavior, which is sudden in onset and abnormal for the patient. When managing hypoglycemia, the EMT wants to ensure an open airway, adequate breathing, circulation, and the ability to swallow. Check for and deactivate the insulin delivery device, or the insulin pump, and administer medication as appropriate, using oral glucose, and provide supportive care. Hyperglycemia is slow in onset, and there will be changes in the mental status. The patient will have rapid breathing and a sweet breath-like odor. There will be dehydration, pale, warm, and dry, and they may experience weakness, nausea, and vomiting, and have a weak and rapid pulse. They'll also have polyuria, polydipsia, and polyphagia. Insulin pumps appear to look like a pager or a smartphone, and they secrete short-acting insulin over a 24-hour period. These insulin pumps are attached subcutaneously by a catheter. The EMT should suspend pump administration or disconnect when treating a patient with hypoglycemia. Insulin pumps track and store helpful information that may assist in determining when and why a hypoglycemic episode occurred.